Your Excellencies, representatives of the Diplomatic Corps and the Philippine government, partners, colleagues, good morning and welcome to our celebration of the World Health Organization's 75th anniversary. I'm Laura Davison, Executive Officer of the Regional Director's Office, and we're so glad to have so many of you with us here today, in person here in our conference hall and online as well. Every year we really look forward to this day where we get to welcome you all here to celebrate World Health Day on April 7th. This year we're a little bit late in celebrating because we delayed for the Easter holiday, but actually we're going to be celebrating all year round because this year is special. It marks our 75th anniversary of the founding of WHO. In 1948, countries of the world came together to establish the United Nations Specialized Agency to promote health, keep the world safe, and serve the vulnerable, so that everyone, everywhere, can attain the highest level of health and well-being. Across this year, we're taking the time to look back at our story, the story that WHO, our member states, our partners, and the people we serve have written together. A story of 7 decades of collective public health achievements, thanks to science-driven learning and collaboration across countries and cultures. And a story of what is to come, as we work to tackle future health challenges for improved well-being and longer, healthier lives for everyone.
This is the story of health. No, it's not just about eating your vegetables and growing taller. It's about how the world's people came together to help us all live long and healthy lives, making amazing discoveries like new medicines and vaccines, guiding us to grow up healthy, strong, and happy, keeping us safe from nasty diseases, painful ones, and deadly ones, and some horrible ones you've never heard of because they were completely wiped out.
The end of smallpox, the magnificent chapter in international collaboration.
This long-awaited malaria vaccine is a breakthrough for science.
Has finally been declared free of wild poliovirus.
It was really a story of human perseverance, innovation, commitment, bringing communities together towards one unified goal.
This is a story about all of us because we all played a role. And if we can keep working together, we'll make more discoveries, have more victories over diseases, and help even more people be healthy and happy in the future.
Ladies and gentlemen, to get us started today on this region's story, I'd like to welcome Dr. Susanna Jakob, our WHO's Acting Regional Director for the Western Pacific. I'd like to welcome her to the podium for her World Health Day address.
Esteemed representatives of the Philippine government and the diplomatic corps, distinguished participants, ladies and gentlemen, excellencies. Good morning and thank you for joining us for this very special World Health Day as we mark WHO's 75th anniversary. This is my first World Health Day in the Western Pacific, and it is such an honor to be here with you all in Manila, the much-loved home of our regional office, as we celebrate our past, present, and future. In 1948, the Western Pacific looked very different than it does today. People lived for only 40 or 50 years. In some parts of the Western Pacific, half of the babies born died before celebrating their first birthday. Smallpox and polio were major threats. Malaria was widespread, and other infectious diseases such as tuberculosis, yaws, and leprosy pose challenges. It was in this context, in the devastating wake of the Second World War, that countries around the world came together and founded the World Health Organization. Since then, we have worked tirelessly to promote health, keep the world safe, and serve the vulnerable. 3/4 of a century on, a lot has changed, and I am glad to say much of it for the better. Thanks to the combined tireless efforts of WHO, your governments, our member states and partners, people in our region now live on average 77 years, a staggering 3-decade increase. Smallpox has been vanquished, and we are just this close to the end of polio. Deaths from malaria have plummeted by 88% in the past 2 decades. Maternal and child mortality rates have significantly declined, and vaccination coverage has reached an impressive 90% for children in the Western Pacific. Today, and throughout this year, we are looking back at the public health successes that have improved the lives of families, communities, and countries. It is also a time to recognize the health challenges we face today and in the future, and recommit to the public health investments, innovations, and actions needed to tackle them. Non-communicable diseases like cancer and diabetes have become the leading causes of death in our region, and our aging population presents new complexities. Vulnerable communities still face barriers in accessing quality and affordable health care, and environmental hazards like air pollution and climate change pose 3 serious threats to public health. And as we all know too well, we continue to experience health emergencies. In 2022 alone, we responded to 19 major events in the region, including COVID-19, Mpox, dengue, and human cases of avian influenza, as well as earthquakes, volcanic eruptions, and tsunamis. But we have been relatively lucky. The international health regulations and 3 iterations of the Asia-Pacific strategy for emerging diseases and public health emergencies helped ensure that through the current pandemic, our region has maintained relatively low mortality rates and achieved the highest vaccination coverage. It is clear that health and well-being have improved vastly since WHO's founding, but the goal of health for all, which drives all that we do, is not yet a reality. Major challenges and opportunities remain. Through our For the Future vision, we are making the Western Pacific region the safest and healthiest in the world. This vision focuses on 4 priority areas: health security, including combating antimicrobial resistance, addressing NCDs and aging, mitigating climate change, protecting the environment and health, and ensuring that even the hardest to reach populations can access health care. We must not lose sight of our goal of universal health coverage, to give people access to health services and financial protection throughout the whole cycle of health care, from prevention to promotion, care, and rehabilitation. as we look back on the 75 years of WHO's remarkable journey, we are reminded of the immense progress we have made. But we also recognize that there is much work to be done. With the unwavering support of countries, partners, and communities, we continue to strive towards the goal of universal health coverage. Together, we can and we must achieve health for all. Thank you for your attention.
Thank you, Dr. Jakob. Today, we want to tell you the story of WHO's 75 years in the Western Pacific. This story began when the first World Health Assembly empowered the regions to be led by a politically appointed regional director and to establish regional committees and regional offices. This approach is unique among the UN agencies and aimed to bring WHO closer to the people that we serve. In 1951, our regional office moved to Manila, first in the port area just down the road alongside our good partners UNICEF. And then in 1959, the office here was established in today's location with the great support from our gracious hosts, the Philippine government. To celebrate our new office and the beauty of the Filipino culture, the renowned Filipino artist Arturo Luz was commissioned to create the 6-panel mural that you can still see outside as you enter the conference hall. In 2009, this conference hall and our campus, like much of Manila, was battered by Typhoon Ondoy. Fortunately, we were able to renovate this space and save the building that we're sat in now, which has hosted countless international conferences and meetings on regional and global health since it first opened its doors. As the years have gone by, we've grown from 8 member states in 1948 to 37 countries and areas today. And as the needs of our member states have changed, WHO too has changed. We now have 15 offices across the region, a sub-regional office for the South Pacific and an Asia-Pacific Center for the Environment and Health. And I'm so pleased that today we're actually joined by our, in person, by our heads of WHO offices and country liaison officers who are sitting here behind me. Now, to say more about WHO and the Philippines' long partnership and the Philippines' generous role in hosting our regional office, I'd like to invite Ms. Christina Rolla McKiernan from the Philippine Department of Foreign Affairs, Office of the United Nations and International Organizations, where she is the Director of the Sociocultural Division. Thanks.
Hello, good morning, everyone. Thank you for the kind invitation. On this special occasion, please allow me to read the message of the Honorable DFA Assistant Secretary of UNEO, Madam Kira Christian D. Azucena. Your Excellency, Dr. Susana Jakob, Acting Regional Director of the World Health Organization's Western Pacific Regional Office, Your Excellencies, dear ambassadors, and members of the Diplomatic Corps, distinguished officials and colleagues from the Philippine government, esteemed officers and staff of WIPRO and WHO Philippine Country Office, special guests, magandang umaga. A good morning to all of you. On behalf of the Honorable Secretary of Foreign Affairs, Mr. Enrique A. Manalo, we are pleased to join you for World Health Day 2023, which is an important milestone year that we celebrate the 75th anniversary of the establishment of the World Health Organization. My congratulations to the WHO team and partners who have carefully organized and curated the wonderful photo exhibition outside that truly captures the good work of the WHO globally and in the Western Pacific region. I understand that there is a similar outdoor exhibition that is ongoing in Geneva, likewise excellent, and which includes historically significant photos of WHO efforts in the Philippines to combat tuberculosis and malaria, and to improve mental health care. It will certainly be a great pleasure for all of us here today to have a wander around later to immerse ourselves properly in the story this exhibition has to tell. The Republic of the Philippines is proud to be a significant part of WHO's history. We recall that 72 years ago, the Philippines, as represented by Health Undersecretary Dr. Regino Padua, was elected in Geneva as a chair of the WHO's Western Pacific Regional Committee. And it was at that meeting where it was decided that the Western Pacific Regional Office would be established here in Manila. From the temporary office headed by the chief and supported by a deputy chief, 3 advisors, an administrative and finance officer, and a secretary in September 1951, WIPRO in Manila has evolved fantastically to become the robust organization it is today. It is truly an honor for the Philippines, especially being a WHO founding member, to have been able to host the WPRO to this day, as the regional office continues its unwavering efforts in achieving the aims of the WHO, keeping attuned and responsive to the ever-changing landscape of global and regional health priorities throughout the decades. We are also proud that a good number of Filipino WHO personnel have been able to contribute to the impressive accomplishments of the regional office. We commend the WHO officials and staff coming from all of our member states for the outstanding professional, dedicated service and commitment to the well-being of all citizens of the world. It was fortunate that we had been able to welcome WHO Director General Tedros to Manila last year, where we had the opportunity to meet with His Excellency President Ferdinand Marcos Jr., who reaffirmed the Philippines' commitment to its strong and enduring partnership with the WHO. In closing, allow me to leave you with Undersecretary Padua's inspiring words from 1952 that still remain relevant to this day. In his statement as a retiring chair at the 3rd Regional Meeting in Saigon, he said, "It is true that countries in the Western Pacific area are separated by large bodies of water. However, this does not create any difficulty in the prosecution of work, nor lessen interest in international health." He also said that the Regional Committee is not concerned with political questions, but it cannot ignore existing realities, which might ultimately affect the health of the peoples. It is the committee's duty, therefore, to be on the alert when public health is menaced, and it should join hands in order to solve health problems, not on the national, but on an international level, thus serving mankind and the interests of the public health in general. With these wise words of a pioneering leader of the WIPRO, I wish to thank WHO for the kind invitation and express my congratulations on this meaningful commemoration. Thank you and happy World Health Day. Magandang umaga muli at mabuhay ang WHO. Long live WHO. Thank you.
Thank you so much, Ms. Rolla McKernan, and thank you to the Philippine government for continuing to be such gracious hosts. We are really very appreciative. As we continue with our story, we'd like to look at our shared past, present, and future, and how together, with our member states, partners, and communities, we've been fulfilling our mandate of promoting health, keeping the world safe, and serving the vulnerable. First, I'd like to introduce my colleague, Dr. Hiromosa Okayasu, Director of our Division of Healthy Environments and Populations. Over to you, Dr. Okayasu.
Thank you very much, Lola. In WHO's founding year, member states embraced a set of principles to promote and protect health of all peoples. The WHO Constitution declared that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Since then, this principle has guided our work, and the story of promoting health over the past 75 years has been marked by many achievements. In 1948, our parents and grandparents had a life expectancy of between 40 and 50 years. Hunger and nutritional deficiency shortened lives and impeded people and society from achieving their potential. Today, thanks to public health investments and innovations, people of our region now live productive lives for decades longer. Progress in nutrition and food policies, such as sugar-sweetened beverage taxation, food labeling improvements, restriction on food marketing to children, and regulations on sodium and harmful trans fats are supporting people to eat healthier. And with the 1981 adoption of the International Code of Marketing of Breast Milk Substitutes, we've also made strides in protecting breastfeeding for millions of babies. Tobacco smoking is declining thanks to countries' implementation of proven interventions, and then the Framework Convention on Tobacco Control, which was the world's first public health treaty and legally binding in all countries in our region. In 2011, Australia made history as the first country to require plain packaging of tobacco products, paving the way for the other countries to also take more aggressive steps in tobacco control. However, emerging challenges remain. The Western Pacific has one of the largest and fastest growing older populations, and the world around us continues to advance at rapid pace. Individuals, households, and populations are grappling with a double burden of malnutrition, where persistent undernutrition is present alongside massively growing rates of overweight and obesity. And despite progress in tobacco control, the projected decline in tobacco smoking is not sufficient to meet global targets. With the aging populations, changing lifestyles, and urbanization, we have seen sharp increases in NCD rates. Today, almost 9 out of 10 deaths in the regions are due to NCDs, placing a significant burden on national economies. We must orient social and health systems, transforming the disease treatment-centered sick system into a health system that addresses the complex interplay of factors driving diseases, prevents illness, and support people through the life course. As our societies age, we need long-term whole-of-society approaches, recognizing the valuable contributions that older adults can make when they are supported and encouraged to do so. If we do not take intensified and coordinated action now, the burden of NCD will continue to grow, impacting both the health and economic well-being of our communities. To speak more on the progress and remaining challenges, particularly for tobacco control in our region, I'd like to invite Dr. Ulysses Dorotheo, Executive Director of Southeast Asia Tobacco Control Alliance, to take the floor. Over to you, Dr. Ulysses.
Thank you, Dr. Hiro and WHO colleagues for this opportunity to showcase tobacco control in our common struggle for health for all. Good morning, Excellencies. Can we have the first slide, please? I'm proud to say that the Western Pacific region remains the only WHO region with 100% ratification of the convention. The region also has had a number of important global milestones. Next, in 1970, 30 years before the FCTC was negotiated, Singapore was the first country in the world to ban smoking in buses, cinemas, and theaters. And in 1971 was the first to ban tobacco advertising. Next, in 1981, Dr. Takeshi Hirayama published his seminal paper on lung cancer caused by secondhand smoking, providing robust evidence for why 100% smoke-free environments are needed. Next, in 2012, as you heard Dr. Hiro say, I think he said, Australia implemented the world's first plain or standardized tobacco product packaging. Next, today, sorry, I thought there was another slide. There are more than 20 countries that have implemented plain packaging, Thailand and Singapore being the first in Asia to do so. And we hope there will be many more. In 2013, the Philippines implemented a major tobacco tax reform that simplified its tobacco tax structure, raised tax rates by 150% on average, and earmarked tobacco and alcohol revenues for universal health coverage. That reduced the number of adult smokers by 1.4 million people. Next. And there's the slide on plain packaging in Thailand and Singapore. Next slide. With strong political commitment to tobacco control and effective implementation of the FCTC's demand reduction measures, we have seen major declines in smoking. Australia is now down to 11% among adults, Singapore 10.1%, Hong Kong 9.5%, and New Zealand 9.4%, currently the region's lowest. Congratulations to these jurisdictions. Next slide. Unfortunately, as we heard, and as shown in this graph from the 2021 WHO report, many other member states have not fully implemented these same life-saving FCTC demand reduction measures and have not been as successful in reducing tobacco use among their peoples. Next. Parties to the FCTC cite inadequate human and financial resources and tobacco industry interference as the main obstacles for tobacco control. Next. And this has been complicated further by the introduction and proliferation of new tobacco and nicotine products. Next. These products and the industry's exploitation of tobacco harm reduction are a clear threat to our youths and tobacco control progress globally. Next slide. We therefore need governments to give greater, if not equal, attention to the tobacco pandemic as they have done for the COVID-19 pandemic, committing to accelerate full FCTC implementation. Next slide. Last year, New Zealand passed legislation to accelerate the achievement of a tobacco endgame. New measures include reducing the availability of tobacco products by prohibiting cigarette sales to anyone born from 2009 and onwards, and reducing the number of tobacco retailers to only 10% of their current number, and reducing the addictiveness and appeal of tobacco products by reducing their nicotine content. Next. Smoking bans, advertising bans, and health warnings are necessary for denormalizing smoking, but we need to do more to achieve the tobacco endgame in our lifetime. Next slide. New Zealand has started to show us the way. So we need to unleash the full power of the WHO FCTC, particularly at the coming FCTC Conference of Parties in Panama this November. Through strict product regulation, such as standardized plain packaging in all countries, banning flavors in all products, and strictly regulating nicotine. Through supply reduction, by phasing out sales of commercial tobacco, legislating a tobacco-free generation, and providing alternative livelihoods for growers and workers. And finally, by holding the tobacco industry accountable for the harms it has done. Next slide. Tobacco became a pandemic with the advent of mechanization and globalization at the turn of the 20th century. It took the world's leaders a little more than 100 years to adopt the WHO FCTC as a global response to this tobacco pandemic. Our children, those are my children, hope it does not take that long to end the tobacco pandemic for them and all future generations. Thank you, ladies and gentlemen.
Thank you very much, Dr. Doroteo. The region's progress would not have been possible without the immense and collaborative efforts of our partners. We look forward to continuing our work together to tackle the challenges ahead. WHO's work to protect people from harmful risk factors and support long, healthy, and productive lives extends to all countries and areas of the region. We must tailor solutions to the local context, including in the Pacific Islands, where the nations face a triple burden of non-communicable diseases, communicable diseases, and then the rising health impact of the climate change. It is essential that we create healthy societies and design people-centered health systems that meet the unique needs of each country and an area. I now hand the floor to my colleague, Dr. Kim Eva Dixon, WHO representative to Samoa, American Samoa, Cook Islands, Niue, Tokelau, to share more on the Pacific context and the challenges and opportunities for promoting health in this region. Dr. Dixon.
Thank you. Your Excellencies, distinguished guests, ladies and gentlemen, and colleagues, good morning. In 1995, ministers of health in the Pacific demonstrated visionary leadership and collective spirit by creating the Yanuka Island Declaration. This was the first Healthy Islands vision that aimed to promote and protect health across sectors. The Pacific health leaders envisaged healthy islands as places where children are nurtured in mind and body, environments incite learning and leisure, people work and age with dignity, ecological balance is a source of pride, and the ocean which sustains us is protected. This vision remains just as relevant today as it did then, and it continues to guide us in the approach to addressing non-communicable diseases by supporting a focus on the environments in which people are nurtured, work, and play. Sadly, non-communicable diseases are the leading cause of death and disability in the Pacific, responsible for around 75% of premature deaths. Pacific nations also have obesity rates amongst the top 10 highest countries in the world. Climate change is also a significant threat to people's lives and livelihoods in many parts of the Pacific. Extreme weather events, especially cyclones, floods, and droughts, are displacing populations, causing injuries and psychological trauma, and are increasing the risks of infection and malnutrition. Hotter and wetter climates are increasing the risk for vector-borne disease. Disasters related to climate change are disrupting the delivery of healthcare services and are increasing the risk of disease and death among vulnerable groups. Without immediate climate action, disease-carrying mosquitoes will have greater reach. Salt-soaked soils caused by rising sea levels will make it more difficult to grow healthy food. And climate-fueled superstorms will put lives at risk. To address these challenges, WHO is supporting countries to monitor the health impacts of climate change and the environment, while strengthening health sector resilience to withstand climate shocks. Working across sectors, WHO is shaping the policies that protect the health of the planet and its people. If we strive towards making the Healthy Islands vision a reality, we can tackle the escalating rates of non-communicable diseases while also taking decisive action to address climate change. Achieving the vision requires our collective effort. I'd like us now to share a video to inspire us all to continue working together towards a future that is healthier, happier, and more vibrant for all. Thank you.
Climate change is affecting the local produce. Once there is a flood, produce will be low, the supply will be low, and then prices will go up as well. You get this cabbage for like $10, $5, but you can get something from the shop, like noodles, for just $2.50, and you can feed like a lot of people with that.
I am so worried. If they use polluted water, they have more chance to get disease.
We're doing mosquito control. When we go out there, we collect all the mosquito, bring them back to the hospital. I need a mosquito, check what kind of species are they, make sure these mosquitoes don't carry the virus, like Zika virus, dengue fever.
Thank you, Dr. Okayasu, Dr. Dorotheo, and Dr. Dixon. As Dr. Dixon mentioned, disasters related to climate change can be incredibly disruptive to healthcare services. And these are not, of course not, the only emergencies that we face. To tell us about how we've been keeping the world safe, I'd like to turn to Dr. Babatunde Olawokure, our Director of Health Security and Emergencies. Over to you, Babatunde.
Thank you very much, Laura. Excellencies, ambassadors, distinguished guests, ladies and gentlemen. Over the past 75 years, WHO has been at the front line of all major health emergencies, from cholera to dengue to Ebola, to human cases of avian influenza, volcanic eruptions, tsunamis, and typhoons, and, of course, the COVID-19 pandemic. Each time, WHO's unique convening role, technical expertise, and partnerships are activated to respond rapidly and at scale, moving people, resources, and supplies to where they are most needed to protect people from the risks and consequences of epidemics, pandemics, and disasters. Our joint vision for the future describes how ensuring health security and advancing universal health coverage are interrelated goals, and how resilient health systems can prevent and mitigate emergencies. Pivotal to WHO's response to emergencies is dedication of our workforce. One person who leaves a legacy and example of the dedication of WHO staff to protecting the lives of people is our dear friend and colleague, Dr. Carlo Urbani. On the 12th of March 2003, WHO alerted the world to an outbreak of SARS, or severe acute respiratory syndrome, in the Western Pacific. Carlo Urbani was an infectious diseases expert for WHO at the time. It was Dr. Urbani who first identified SARS as a new and highly contagious disease. Through Dr. Urbani's swift action, dedication, perseverance, and unyielding commitment to protecting people's health, an early warning was triggered and a swift global response followed. Sadly, Dr. Urbani himself became infected with the virus while working closely with patients and alongside the health workforce in Vietnam. He passed away on the 29th of March, 2003. Dr. Carlo Urbani's memory and legacy, however, lives on. UN Secretary General Kofi Annan described how, I quote, Dr. Urbani leaves an inspiring legacy in the United Nations family and the global public health community. For his contribution on the front lines of the fight against disease, he will be remembered as a hero in the best and truest sense of the word. End quote. Recently, WHO Director General Dr. Tedros Ghebreyesus joined the opening of the Carlo Urbani Museum in the hometown of Dr. Urbani. We will now show you a tribute from colleagues who knew and worked with Dr. Urbani in Vietnam.
Kind, friendly, and warm and care person.
He's not only a respectable boss, a passionate public health specialist, but also a dear elder brother.
So we always call him as Anh Carlo, because we considered him as our older brother.
To Dien Bien is very tired because the road is mountain is very difficult. But he said, no, we will go by car because he enjoyed environment and landscape in northern of Vietnam.
He drove his means motorbike daily to the office and traveled with that motorbike with family to many places in Vietnam.
He was there when I was at most difficult time when I had some health problems. He provided me with support, encouragement, and caring advices. And those advices helped me to overcome my difficulties.
We vowed not to let Dr. Urbani's death be in vain and to ensure his legacy lives on. Following SARS, the world revised the legal framework known as the International Health Regulations, or IHR, based on the SARS experience. Across the Asia-Pacific, we went further and developed a bi-regional action framework called the Asia-Pacific Strategy for Emerging Diseases, better known as APSED, to implement the revised international health regulations. Developed in 2006, APSED envisions a region that is better prepared for public health emergencies through the collective action and efforts of member states, WHO, and partners. It has been a long 16 years investment in health security, and while it has not been easy, it has definitely been worthwhile. Our commitment to building capacities, strong public health systems, effective multi-source surveillance, communication, and regional mechanisms all came together in a unique way to spare us from the scale of devastation seen in other parts of the world from the COVID-19 pandemic. Indeed, the Lancet Commission on COVID-19 highlighted how APSED and regional solidarity provided a foundation for countries in the Asia-Pacific region to respond to COVID-19. Learning from our experiences, not only from COVID-19, but from other emergencies over the past 20 years, we are now developing a new regional action framework for health security, the next iteration of APSED, that focuses on equity, inclusivity, and connecting health security systems. A new pandemic accord is under development with the aim of building a future global strategy to protect new generations from pandemics in the 21st century. The IHR is also being reviewed to strengthen preparedness for future health emergencies. The continuing solidarity shown by member states in responding to COVID-19 is essential for us to move forward. Ensuring health security for all is reliant upon a strong primary healthcare foundation which enables resilience within communities and can advance the global aim of achieving universal health coverage. COVID-19 reminded us all that health is central to our societies, economies, and our social development. This region has always been futures thinking, and that is what has and will continue to put us ahead of the curve as we implement For the Future vision and the new strategic framework for health security. Thank you very much. Laura, back to you.
Thank you so much, Dr. Olawokure. COVID-19 has made abundantly clear how important health is to all of us in everything that we do. But access to good health and well-being isn't equal. I'm pleased now to hand over to Dr. Hong Tran, our Director of the Division of Programs for Disease Control, to talk about how we've been serving the vulnerable, from eliminating diseases to protecting mental health. Over to you.
Thank you very much, Laura. Please allow me to start with a powerful tale showing our collective work's profound impacts on disease eradication and elimination over the past 75 years. Smallpox was a highly destructive disease that plagued humanity for thousands of years. However, the development of the first successful vaccines in 1796 led to a global effort to eradicate the disease. In 1980, this effort culminated in the 33rd World Health Assembly officially declaring the world free from smallpox, marking it as the most significant accomplishment in international public health history. And we have made many other achievements. Polio has almost been eradicated, with the Western Pacific region being declared polio-free in the year 2000 and maintaining its polio-free status for more than 20 years now. Numerous neglected tropical diseases, including lymphatic filariasis, trachoma, Guinea worm, have been eliminated, and malaria have significantly decreased in the Western Pacific region. Thanks to effective vaccination program and disease control efforts, WHO and member states work together to eliminate measles and other vaccine-preventable diseases, including diphtheria, tetanus, rubella, and resulting in remarkably lower infant illness and death rates, increasing life expectancy and reduced poverty. All of these public health victories have had significant life-changing effects on millions of lives, and achieving those would not have been possible without the important work being done in the countries. Keeping people and countries at the center of everything we do is one of our guiding principles in the Western Pacific region. To emphasize this point, I would like to introduce Dr. Pascal Ringwald, coordinator of the Mekong Malaria Elimination Program, who will share a success story of malaria elimination efforts in the Mekong sub-region, where concerns of drug-resistant malaria spreading was addressed and malaria was dramatically reduced. Over to you, Dr. Pascal.
Thank you very much, Dr. Tran. Honorable guests, ladies and gentlemen, facing the threat of anti-malarial multi-drug resistance, 6 countries, Cambodia, China, Lao People's Democratic Republic, Myanmar, Thailand, and Vietnam adopted the WHO strategy for malaria elimination in the Greater Mekong sub-region in 2015, with the ultimate goal to eliminate malaria in the entire sub-region by 2030. China malaria-free status was certified by WHO in 2021. 3 countries in the Greater Mekong sub-region are close to elimination. The number of cases in Cambodia, Lao PDR, and Vietnam declined between 2018 and 2022 by 92% for all species, while malaria deaths fell by 86%. This success could not be possible without a common vision shared among the 6 countries endorsed by the Ministerial Call for Action signed in 2018, the financial support from multiple development partners and funding agencies, the technical support from the 3 levels of WHO collaborating with the national malaria programs and partners to implement innovative approaches targeting most specifically the forest goers, mobile and migrant population, and ethnic minority groups. Last but not least, the strong engagement of the communities in which activities are rolled out through village health workers, village malaria workers, and more recently, mobile malaria workers who are mobilized in areas close to the forest, allowing deployment of diagnostic and treatment for the most hard-to-reach population. Thank you very much, and back to you, Dr. Tran.
Thank you, Dr. Pascal, for the inspiring story about malaria elimination efforts in the Mekong sub-region and for showcasing the importance of our work in the country. Ladies and gentlemen, in celebrating public health achievements over the past 75 years, we must not forget that diseases once thought to be controlled can return with health systems are not resilient or when the complacency set in. I would like, therefore, to take a moment to show you a video about Mai, a mother in a slum area in the Philippines who struggled to get her children vaccinated against measles.
Gulat kami bakit nauso dito yung tigdas dito sa amin. Nag-umpisa po noon sa taas po namin nakatira. Tapos po sa katabi rin po namin nagkatigdas. Tapos yung anak ko pong tatlo, ayun po, kawawa na po. Bali, ang pamilya ko po malaki, marami po akong anak. Yung anak ko po, 7, anak ko po, yung mga kumpleto po bakuna. Bali, 3 lang po. Ayun, hindi na po napabakunahan. Yung 3 po, yun. Yun talaga po yung mga nagkatigdas. Nung bali po nung kasama po yung tatay ko, ayun po, medyo nakakalawa kasi nakapaghanap buhay po ako. Bali, tatay ko nagbabantay. Ito lang talaga na wala lang din tatay ko. Wala magbabantay sa mga anak ko. Ayun lang po, di na ako nakapagpadala sa center. 9 months po yung baby ko. Tapos sumunod po, 3 years old, tsaka 4 years old po. Nung nagkatigdas po. Una nilalagdas, may ubo po. Tapos nakita ko po, pamumula na po sa katawan nila. Mga ilang araw, naging itim na. Kasi dumami na sila ng dumami. Lagnat lang po talaga yung binabantayan ko kasi yung pinakakatakot. Yung mag-convulsion, sabay-sabay po sila, 3. Doon po ako natatakot kasi umiyak lang. Hindi ko alam po ano yung nararamdaman po nila. Kaya natatakot ako. Anong masakit sa'yo? Natanong ko lang gano'n. Wala, iyak lang. Naawa po yung mga kapatid niya po. Sabi nga ng anak ko po, ba't di pa dahil sa ospital? Kasi nga yung natakot nga rin anak ko po. Sabi ko, paano ko dadalhin? Wala magbabantay sa ibang kapatid mo. Pumayat po talaga sila, natuyot yung balat, halos ayaw kumain. Sabi ko nga, kung pwede lang, balikan talaga. Sisisi rin din po kasi ako nun. Kung napapakuna ako po talaga, hindi sana magkakagal yung mga anak ko. Nakayanan din po sa awa po ng Diyos. Siguro pa mga 5 araw, 4 na araw yun, nakakain na po sila. Okay na po sila. Normal na po. Yung panganib po na apo ko po, ayun, kompleto rin po bakunan. Talagang pinaano ko sa anak ko na pabakunahan niya yan. Libre naman yan, wala namang bayad. Bakit di ka magpabakuna? Sabi ko sa anak ko. Ang sasabihin ko lang po sa kanila na hanggat maaga, pabakunahan mo yung anak mo. Ito kong anak, hindi nagkatigdas. Tapos yung 3 nagkatigdas. Mahalaga po talaga yung bakuna. Wag po silang tamarin. Parang sinasabi po nilang di totoo yan. Totoo po talaga yung bakuna po.
The story of Mai is a stark reminder that diseases we thought was under control can return with devastating consequences and underlies the importance of reaching the most vulnerable and unreached populations. Measles cases have risen in several countries due to low vaccination during the pandemic, and to prevent the widespread outbreaks, we need to have countries with large-scale immunization catch-up campaigns and revitalize routine immunization programs. Vaccines are essential public health tools, and we must ensure vaccination coverage everywhere. In preventing previous health challenges from reappearing and addressing the existing one, we must also look to anticipate the health challenges of the future. As my colleague Dr. Hiro Kayasu said earlier, non-communicable diseases like diabetes, cancer, and heart disease are a significant and growing challenge in our region. We must act now to transform health system with primary health care as a foundation to deliver NCD services to people we serve, to prevent the premature death due to NCD and increase the quality of life. Mental health is another important area of concern. When thinking about how to address some of the health challenges of the future, I got inspired by the story of Romy in New Zealand, After being outed as a gay, Romy struggled with addiction and mental health issues. Drawing inspiration from her journey towards wellness and recovery, Romy today works as the lived experience advisor who helps other people access mental health services using her personal experiences. For Romy, taking care of the people she cared about is a responsibility she takes seriously. Whether it is her friends, family, colleagues, classmates, or people she interacts with every day, Romy feels a sense of duty to look for others just as they would do for her. This story about Romy is a vivid example of the new approach set in the recently endorsed Regional Framework for the Future of Mental Health in the Western Pacific, which offers strategies and action to refocus the mental health agenda, transform mental health services, and embed mental health into community and daily life. Achieving our for the future will require our collective efforts, determination, unwavering commitment to equity, solidarity, and inclusivity. So let's draw inspiration from our past successes, lessons learned from the COVID-19 pandemic, and stories like Mai and Romy as we work together to build a healthier, safer, and fairer future for all. Thank you very much.
Thank you so much, Dr. Tran, and Dr. Ringwald as well. As we were contemplating how we were going to mark yes, please feel free. As we were thinking about how we were going to celebrate WHO's 75th anniversary this year, it was really important to us that we not just look back at our past and the challenges of today, but that we also think about tomorrow. This region's vision for the future is based on the concept of looking towards a future of health that we desire and working backwards to better understand how we can get there. I'd like to turn to my colleagues, Martin Taylor, our Director for the Division of Health Systems and Services, and Dr. Kidong Park, Director of Data Strategy and Innovation, to discuss the challenges and the opportunities for health for all in the future, and what we are doing to support our member states to address these. Over to you, Martin.
Thank you very much, Laura, and good morning, Your Excellencies. Many of the public health successes that we've been hearing about this morning have been based on the foundation of countries in our region building stronger healthcare systems, measured by the Sustainable Development Goal indicators of coverage of healthcare services and financial protection. This region has made great progress. This means that many people have access to healthcare services that they did not have or their previous generations did not have, and also that they have increased financial access, that the barriers for them being able to afford healthcare have reduced. This has been largely underpinned by strong economic growth across the region. Of course, it's not universal. Some countries still have some challenges, in particular in terms of reducing the financial barriers so people do not have to pay out of pocket for healthcare. These stronger healthcare systems provide a great platform for addressing the public health challenges of the future. My colleagues have been explaining what some of those are. Increasing burdens of non-communicable diseases, aging populations, climate change, health emergencies, and still in some countries, persistent, vulnerable, poor populations. Addressing these challenges in the future will require a different kind of health system to the health system of the past. It will require a health system that can help people stay healthy, whilst also responding to those challenges that do and will exist. Only healthcare systems based on primary healthcare will be able to do this, and will be able to do this in a way that addresses those future public health challenges, that is financially sustainable, that is resilient to shocks, and that is equitable so that all populations can benefit and nobody is left behind. In the future, countries will need to invest more in those healthcare systems that can help people stay healthy and address those challenges, and by developing, in particular, locally appropriate models of primary healthcare that fit the needs of local populations. Key and very important in this will be investing in the health workforce that will be required in the future, and in particular, investing in nurses and general practitioners who will be at the front line of delivering the healthcare services that will be needed in the future. I pass now to my colleague, Dr. Kidong Park.
Thank you, Martin. Your Excellencies and distinguished guests, as we celebrate 75th anniversary and past successes, I'd like to reiterate our mandate of putting the future up front to make the Western Pacific the healthiest and safest region. It is possible only by systematically looking into the future, then starting at the desired outcomes, and then working backwards to identify shorter-term actions that we will prepare for what may come next in our rapidly changing world. WHO, we have been supporting member states adopt strategic foresight to develop and drive national long-term transformation agenda that will improve population health and well-being for all. These processes surfaced opportunities and then challenges for future health systems. For example, ever-evolving digital technology may enable more interactive and individualized health care. But we will need to make sure that rural and vulnerable communities benefit as well. Additionally, member states are envisioning the concept of the health expanding to wellness and well-being, with ramification going as far as the creation of the Ministry of Happiness, which could be established to embrace well-being into health systems. We also gathered people from different disciplines to discuss health futures. Think tankers of the historians delved into the role of the government and WHO in future pandemics from past experience. Futurists, journalists, health practitioners, policymakers, and government officials explored not only health, but also how changes in society, economy, and technology could shape our future. They emphasized the need for equity and inclusivity. From youth, we crowdsourced innovative solutions to tackle current problems for a brighter future. Artists, through their artwork, warned about isolation, food scarcity, climate change, and more, and called for more attention to people in the blind spot who will risk suffering more. By now, you may have noticed that there is one key concept that repeatedly arises. It is equity. Now is the right time to look to our next 75 years and think of ways to ensure health for all in our region that leaves no one behind. Envisioning the future of health can be daunting and exciting at the same time, but systematically planning now for the long-term future we want to see, we can ensure our health systems are more inclusive, resilient, equitable, and efficient for generations to come. WHO looks forward to continuing to support member states in planning for and actively working towards this desired future. Thank you.
Thank you so much, Dr. Kidong and Martin. As we come towards the end of our program this morning, I'd like to turn to one of our valued member states and partners. Germany is a strong global health leader in its own right, and also one of WHO's largest supporters in recent years. WHO and Germany are working side by side to strengthen global health security, combat antimicrobial resistance, and strive for universal health coverage, driving impact in countries and helping to build systems which save lives and protect the vulnerable. I'd like to invite Her Excellency Anke Reifenstuhl, Ambassador of the Federal Republic of Germany to the Philippines, the Republic of Palau, the Republic of Marshall Islands, and the Federated States of Micronesia to take the floor to reflect on WHO today and in the future.
Thank you very much, Laura. Distinguished representatives of WHO and UN agencies, of the Philippine government, colleagues of the diplomatic corps, ladies and gentlemen, good morning. First and foremost, congratulations to WHO on the 75th anniversary. It is a great honor to be with you today to also celebrate World Health Day. As we look back on more than 7 decades since the WHO's establishment, the importance, contribution, and growing relevance of WHO to promoting health, fighting diseases, and responding to global health challenges and crises is undeniable. WHO has shaped global health policies through its science-based policies and programs. From emerging epidemics like the COVID-19 and Zika to other diseases like HIV, AIDS, malaria, and tuberculosis, as well as chronic illnesses like heart disease or cancer, the WHO has been at the forefront of promoting health and preventing diseases worldwide. As we have seen in today's presentations, a lot has been achieved, but a lot more still needs to be done. In the Philippines, as well as in the Western Pacific and overall Asia region, where many cannot access quality health services, universal health coverage and reducing health inequities are key areas of intervention of the WHO. I am proud to say that Germany has been contributing to this important work as a long-time reliable supporter of the WHO, becoming a member of the organization 75 years ago. Just a few weeks ago, Germany announced another 130 million euro contribution to the WHO for this year, 2023, reinforcing Germany's role as a global health leader and one of the WHO's strongest supporters. Germany was WHO's largest overall contributor in 2000 and 2021. And Germany has been the top donor in the COVID context regarding the ACT Accelerator, a global collaboration to quickly develop, produce, and fairly distribute COVID-19 vaccines, tests, and treatments, including those under COVAX. Germany's total contribution in the COVAX context since 2020 amounts to more than 3.5 billion euro. Germany is also the top donor of WHO's contingency fund for emergencies, one of WHO's most powerful tools for responding immediately to acute health emergencies around the world. This commitment is guided by our conviction that had also become the slogan in the COVID pandemic: no one is safe until everyone is safe. The interconnectedness between health and progress and economic development has been underlined by previous speakers. The COVID-19 pandemic has shown all of us that our work is not done. As we have painfully learned, new communicable and non-communicable diseases are constantly emerging. We must not lose sight of the challenges that are not so much in the public attention. We have seen in the presentations, as well as in our everyday experience, the alarming increase in HIV/AIDS here in the region. Due to the COVID pandemic, vaccination and immunization programs on other diseases have seen delays and other hurdles. So in moving forward, we need to work together towards preventing and preparing for health emergencies, as well as to further strengthen our health systems to deal with the new challenges. As I was able to witness personally during my numerous encounters with WHO representatives during the pandemic, WHO has proven through its dedicated and impressive commitment that it has the leadership and expertise to guide us through crisis in the future. I would like to thank you, WHO, for this invaluable guidance. I'm looking forward to continue our partnership, and I wish you continued success in your work during the next 75 years beyond. Thank you.
Your Excellency, thank you so much for those words. Ladies and gentlemen, I hope you've enjoyed our story today. The story about how for 75 years we've been promoting health, keeping the world safe, and serving the vulnerable. And how, together, we will continue to do so in the future. Because the goal that has guided us since 1948 is as important today as it was when we were founded. The goal to work together to improve the health and well-being of every person and achieve health for all. For those of you online, thank you so much for joining this morning. I know there's many of you, member states, partners, and we have colleagues from right across the region joining us today. Thank you for everything that you've done in your work with WHO. I wanted to just stop to give a quick round of applause for the hardworking colleagues. And for those of you in the room, please join us for a light reception we'll have in our outdoor area outside of our cafeteria. You'll see our art exhibition continues there with a digital exhibition on the future of health. But first, we would also like to invite you into the center of the horseshoe to take a group photo. Thank you, everyone, for joining us this morning.